Hi, DrBiology here. It is the 29th of February 2020, and this is just a quick update on the spread of the coronavirus COVID-19. So currently in the UK, there are 23 cases. There is one case now that no one knows where that person got the infection from. And the World Health Organization are on their highest alert. So in this short update, I'm going to show you the number one way you can reduce your chances of any infection, not just COVID-19, but any other type of viral infection.
Okay, so let's look at the current distribution. This is from the World Health Organization as of 28th of February. So you can still see the vast majority is in China, although the spread of the COVID-19 has slowed down somewhat. But there are new kind of areas of problems, particularly in South Korea and Japan, and then also in Iran, and then in Europe, in particular parts of northern Italy. There seems to be a large outbreak. So in the UK, as I've already said, there are 23 cases at this moment in time, and today, this is the 29th of February, there has been the first case in Hazelmere in Suffolk of a man who has not been abroad and believes, well, he doesn't know where he would have got it from. So it's the first UK-born infection. Also, starting to get a few cases in Africa, okay, and also there are a few cases now growing in the United States of America and Canada, so it is definitely spreading. So in China, the source of the outbreak, there's been nearly 80,000 cases so far in China, and there have been around about 2,837 deaths. Now what's interesting is China has taken a really strong view on isolating populations and reducing the spread, and you can now see that the actual confirmed cases of coronavirus have dropped considerably compared to the peak after around about the second week of February. So you can see that their strategies are working. So if it's reducing in China, what's happening elsewhere? Well, outside of China, there is an increase, a massive increase, but saying only about 1,500 people in a population of 7 billion is not a lot really, but it is going to increase, and you'd expect it to increase. It's a virus, as other viruses will spread, so will this one. So in the UK, as of 29th of February 2020, there are only 23 cases. So we really do need to get this into perspective. The cases are varied, and obviously it's going to spread, but I need to tell you that you don't panic. Do not panic. This is mainly a virus that affects the respiratory system, and the vast majority of people, there are mild symptoms. So if it was to spread, then what should you do? Well, the first thing is, it's really important to state that if you think you have the coronavirus, you do not go to a GP surgery, you do not go to a hospital, because all you're going to do is spread it. What you need to do is go to your home and you need to call 111. Now, the first thing to say is, obviously, if you've been looking at TV pictures and video pictures, you'll see lots of people wearing face masks or surgical masks. Well, I'm here to tell you that they are not very effective. They're really designed to keep droplets and splatter from passing from a person's mouth to nearby surfaces. So they're actually used to reduce infection in terms of you infecting somebody else. It's not actually very effective at stopping you from getting the virus. Your main problem is your hands, because you're going to be constantly moving the mask around. Your hands are touching different surfaces, and as you move your mask on and off, then you're going to infect around your face and around your mouth. Also, many surgical masks fit far too loosely, and therefore they're open around the edges. So the only time really a surgical mask is really useful is if you actually have coronavirus, to stop you from spreading it to somebody else. So you're probably thinking, well, what can you do? Well, there's one simple thing you can do. Wash your hands. Remember the soap. Make sure you get in to all the nooks and crannies. Do each finger. Give it a good rinse under hot water. And my last tip, don't touch the tap. Use your elbow. So that's my number one tip, is wash your hands frequently with soap and water, or you can use a sanitizer gel. Make sure you catch your coughs and sneezes with disposable tissue. If you don't have a tissue, then use your elbow. Don't use your hands, because then you're going to spread all your any pathogens that are on your hands. Make sure any tissues are thrown away, then wash your hands again. And also avoid touching your eyes, nose and mouth with unwashed hands, and avoid close contact with people who are unwell. So overall, I think we just need to get a kind of a level head in dealing with all of this, and just remember that coronavirus is not very common in the UK at this moment in time, and even if it is, most of you should be okay. All right, so look after yourselves, and a new update will be coming shortly.